opioid overdoses on the rise, Connecticut is looking to tackle the epidemic in a new way. Isa Gutierrez has an exclusive look at a groundbreaking program born in Hartford.
There were nearly 500 overdoses in June here in Connecticut. For the first time, we have hard statistics thanks to a new opioid overdose reporting project. It's the first in the nation and helps emergency responders, police, and harm reduction groups tackle the opioid crisis in a new way. And it's right here in our backyard.
After half a dozen overdose deaths in just 2 days in Hartford.
These are alarming stats. 10 fentanyl-related overdose deaths in the last 10 days alone.
It's an epidemic that's taken lives across the country and our state.
I began to see that these people overdosing were young people with viable lives, and not too much was being done in this area.
As a paramedic in Hartford for the last 25 years, Peter Canning has seen it all.
We're, very trained in heart attack care, and stroke care, and trauma care. But over time, I've noticed in the last maybe like 5 years an increasing escalation of the opioid overdoses. But it was suddenly becoming, an everyday occurrence.
That's why he helped start the Connecticut EMS statewide opioid reporting directive, also known as SWORD.
I thought, EMS really hasn't been involved in this at all. And that EMS is in the ideal position because we see people right after they've overdosed.
Through the program, responders at the scene of an overdose follow up with a call to the state's Poison Control Center and answer a series of questions that ultimately help identify overdose spikes in our communities. It's a 3-minute call that goes a long way.
Hi, it's Lori, Poison Control. Can I have your name?
It starts with the basics, like the location of the overdose and age of the patient. Then the questions get more specific. Was the drug inhaled or ingested? What kind of packaging was the drug in? And what else was at the scene?
Is the type of information we're collecting. The name of the bag, the paraphernalia at the scene, pictures, photos of the paraphernalia has really not been collected by other poison centers or other entities. So that's quite unique.
On June 1st, SWORD was implemented across the state. In that first month, EMS reported 496 overdoses, 388 naloxone administrations, and 41 fatalities in Connecticut.
We're a small state, but it is hitting us pretty hard.
Within the first 10 days of June, 10 overdose deaths were reported to Poison Control in the city of Hartford alone. They alerted the public health department, local law enforcement, and harm reduction groups.
Each one of these dots represents an overdose, and this is providing absolute real time. If there are 5 overdoses in an hour in Hartford, we're going to know about that within an hour.
In the past, our data has been very staggered and late. This gives us day-to-day operations so that we can keep our eye on it and send the appropriate resources to the appropriate place.
What started as an idea in the back of an ambulance is now a way to help more people in need before it's too late.
It's a really tragic epidemic, and hopefully we can make a dent in it.
SWORD started as a pilot program in Hartford in 2018 before being expanded statewide last month. The Department of Public Health issued a mandate requiring all EMS responders to take part. The hope is this program will serve as a nationwide model. For a full interactive breakdown of overdoses by county in the first month, visit the NBC Connecticut app. I'm Isa Gutierrez, NBC Connecticut Investigates.